everybody to another episode of Drena Finds Out. This week we are discussing Initiative 65. It's going to be on the ballot this upcoming election, November 3rd. And today I'm talking to the very nice, sweet, loving, caring nurse practitioner, Carricka. How you doing?
I'm good. How are you?
I'm good. Thank you so much for talking to me.
Oh, thank you for having me.
Because a lot of people were like, nobody's going to talk to you about it.
Skittish about it, yeah.
Yeah, so I appreciate you being able to sit down and talk to me about it. So, what I want to ask you is, what is your thoughts and opinions on the bill for medical marijuana?
Well, I would say, first of all, my opinion has changed. In the beginning, I was kind of opposed to it. One, I just always felt like, I've always seen the negative effects for it being a hallucinogenic for some. It can impair. I just always looked at the negative effects of it, and then it always been considered an illegal substance. So I just always looked at it negatively. But over the last 2 years, I've been dealing with more people that have been dealing with chronic pain, a lot of veterans. And I've been finding one common thing that they say that they were doing to help alleviate some of their pain, which they was using some CBD products. And that was my first positive experience with it, where they started telling me about the CBD oils. So after I started hearing so many people using it, I started kind of doing a little research for myself, and I started asking more questions because I wanted to know what benefits or what effects they was having. I had one guy, the first guy that I talked to about, he was on a lot of pain medicine. He was like he could barely walk because of pain. He was fairly young, early 50s, a veteran, and nothing was working. He was on high dose of opioids, it wasn't helping, and he just felt like he just needed to take more and more. Once he started with the CBD oils, he started getting some pain relief, where he didn't need the pain pills as much. And he became such a true believer in it, he started selling it. So, and at that time, it was a small bottle, maybe 3-4 ounces for like $100 a month. But if you find something that's gonna work relieve pain, you'll be willing to pay whatever. I started noticing more people saying the same thing about the pain relief. So I started taking notice to it. Of course, it's illegal here, but I started having some people come to California, and they were swearing by the same scenario that it helped them. Then I started finding patients started telling me that it was giving them a calm effect. It helped alleviate some of their anxiety, because just like what right now what's going on with this pandemic, a lot of people have an increased stress, increased anxiety. They've been using marijuana products to help cope with some of that stress. And I've been finding that's like, okay, these are all good effects. And I always ask people, okay, what negative effects are you having? No one has ever really told me anything negative if they're a chronic user that they experience. And the other big thing is I've also noticed that it's helped some people with sleep. And all three of those things, pain, anxiety, as well as insomnia, most of the time we wind up ending up using some type of control or narcotic to help these people if the alternatives are not working. They always kind of climb up to that point. And I'm always kind of, squeamish about doing it, because once they get to the narcotics, eventually it's going to become a habit. And then my issue is with that, whatever after so long they get used to wherever they at, then we're gonna have to go higher. And it's like, where do we keep going? The one thing that, has always been a big issue and the DEA is starting to get cracked down on is opioid use, because we start to see more and more overdoses, more and more people in rehab because of it, literally destroying families over it. But with marijuana, you really don't see any marijuana deaths or marijuana overdose, not that I know of.
Right.
I've seen some issues or incidents where we did have some adverse effects with marijuana, but it wasn't just marijuana, it was paired with other things. So I think one of the big negative things about marijuana is it is taboo because it's considered a legal substance, but it's never really been studied.
Right.
So because it's never really been studied, we really don't know the long-term effects that it has on a person, and that's what always kind of makes me kind of leery, because that's the first thing you want to know as a provider. What are the adverse? You tell me all the good things, but what are the bad things? Because no matter what you take, even Tylenol or aspirin can have some bad effects if it's taken in a wrong manner. So we always want to know what are the potential adverse effects, but because it has never really been studied, we really don't know. So that's where I think a lot of providers get a little squeamish. But lately, like I said, I've changed my opinion, and I'm now for it, because I do see where it can help some of our people that's in chronic pain, that have anxiety, that have insomnia, and they maybe won't have that stigma that's associated with it, that they can use it to help improve the quality of their life. And I think that's the biggest thing, is always quality, to help improve the quality of individuals' lives.
So once the bill is passed, and then I know in other states, more states will follow. Even though I know that I think it's maybe 8 states right now.
I'm not quite sure yet.
But hopefully more states, and then the studies will be there. And do you think once more doctors have more knowledge or more access to those studies, you think that will be an option to prescribe over opioids or any type of controlled substances?
I think it's always going to come down to personal preference with that, because just like right now, technically I can prescribe opioids as well, but it's going to come down to a provider. Some providers can prescribe it and they choose not to. So it's going to be the same thing with this. If it's legalized, you're going to have a lot of providers that's not going to want to prescribe it because they're just not going to believe in it. It took some time for me to come over.
Right.
So I'm hoping that it's passed, because if it's a possibility for it to help someone, I will be willing to give it to someone to help them, because for me, I'm willing to try a lot of different things to prevent that person from going to the opioid, because I already know at some point they're going to become addicted.
Yeah.
And if they can use this, which is technically a herb, to prevent some of those symptoms, prevent those addictions, and improve their quality of life, and actually make them more of a productive citizen, I'm all for that.
Yeah.
I'm all for it.
I think the unknown is the biggest part, and then also, like you said, with the stigma that goes along with it, with being illegal. I think a lot of people are afraid, even physicians, or people that may be in pain. A lot of people are just afraid to try it because they think, oh, hey, I can go buy this at this store, but maybe they don't know what's going to happen.
Well,
they may think they may end up strung out or something when that's not.
And the same thing with opioids. I have a lot of people, when we do get to that point and we're ready to prescribe to them, sometimes they don't want to take it because they think they're going to become addicted, and they don't want to be associated with that. I think legalizing it can kind of erase a little bit of that stigma, but at the same time, as providers, we're going to have to start educating ourselves on it, the effects, so that when we become more comfortable with it, because it's not good for every patient.
Right.
We're going to have to pick and choose which patient need it, and could benefit from it, and who's going to be compliant with it, because of course that's going to be the other issue, because with anything someone can abuse it.
Right.
And there still need to be some controls on it. And will it be perfect? No, but I do think it could be great benefits that we're missing.
Yeah. I think definitely just opening the door up and getting it passed, those things will follow. I know I've spoken with people who are afraid that, how are they going to regulate, it's like drunk drivers, like somebody can get behind the wheel and drive drunk. Who's to say that this person won't get this, marijuana and then smoke it and then drive? But in that case, I would say a law is not stopping someone from doing anything. because they have access to those things whether they want them or not.
I mean, they're doing it now.
Right, they're doing it now, so the law just puts restrictions or consequences on if you get caught doing those things.
Right, and I think we're just gonna have to start educating the public too.
Right.
With anything, you're gonna have to educate people how to use it. There still need to be regulations. My one thing is too is how's it gonna play with people working,
Right.
with drug testing. Because if something happens to your drug test, you can't really tell if the person smoked last night or if it's been in their system for 30 days because the THC actually stays in the person's body at least 30 days. And the THC is a little bit different that it literally attached to fat cells. So someone who is smaller, the marijuana or the THC will be less detected in 30 days versus someone who's larger, it may take 45 to 60 days to flush out their system. So all that kind of plays a part in it. But again, I just think we need to educate because if they pass it, we still got a lot of work to do.
Right.
Letting the patients know how to use it. But we need to figure out, potentials. We need to start doing that research. Just because I think it's been such a taboo for so long, I think we're doing our patients a disservice by not finding out more about it.
Yeah. I feel like people think that once it's passed, they'll just be able to go anywhere and get it, but just like with controlled substances, we keep going back to that, you can't just go into a doctor's office and say, hey, I need you to prescribe me this many.
Now, technically, I have ran into some people that will say that, but then the answer is like, no.
Right.
No, you can't. You have to have a prescription. They'll have to have a card.
Mm-hmm.
It's going to have to be in that little prescriptive bottle. Because if they're stopped, they have to show where they are prescribed and yet they are the right person for this.
Right.
With anything else.
Yeah. So I know that I've heard that people say, well, that means anybody can get it. Like, no, doctors aren't willing to risk. Most doctors aren't willing to, or nurse practitioners aren't willing to risk their livelihood.
I would say someone who has had a true history of chronic pain that has not been able to be controlled on the traditional medication that we've been using. There's also been, of course, the one thing we found where it has worked with some people with reducing some of the pressure behind the eyes with glaucoma. Someone who has anxiety, I wouldn't try this on someone that has anxiety that's 18 or 19. I would try a more mature adult that will be able to handle it. If I tried other methods and it hasn't worked, well, maybe, and that's the thing is you're gonna have to pick your patients.
Right.
But before you prescribe it to someone, they should have a history. It shouldn't just be someone just walking in and say, okay, I need a medical marijuana card, and you just give it to them. It should be a documentation backing what you're saying and what they're saying that dictates the need for this.
Yeah, I think that, and then people also have to keep in mind, if it's going to be medically prescribed, then that means your insurance is going to be a part of it. So it's going to take steps in order to get to it. So it's not going to be like a free-for-all for everyone. So I'm hoping that people will take heed and dig up as much information as they can, watch this interview with you, and go to the polls and vote yes for Initiative 65.
Yeah, I hope they do go vote. And the main thing, just keep an open mind, because it may not be useful for you, but it may be useful to someone else. I literally just went home. I'm originally from New Orleans. I went home about 3 weeks ago, and my dad, he's been having pains for years. And I was surprised that he's already using CBD chews. I'm like, what? I mean, this somebody, you can't smoke in his house. My brothers, if they will earring, they take them out. No one smokes, no drugs, no alcohol. And
yeah,
he found the benefits and effect, and he's like, hey, I need some of that. So anyone I've came into contact that's using it for pain has shown where it works.
Yeah. I know people that use it for arthritis, fibromyalgia, a lot of older people, not just older people, but people that have any joint pain issues, people with seizures. So the list is so long, and hopefully that those people will be able to get the relief that they need, and hopefully people will get it passed for this state.
Yes, yes. Just keep an open mind, and I hope that you do choose to vote for Initiative 65.
All right. Thank you for talking to me. I appreciate it.
All right. Thank you for your time.
Thank you.